Hello everyone, this is Akulina and you are listening to the Coffee with Lina podcast. Today we are talking with Dr. Kien, who works in the Family Medicine Department of Hanoi Medicine University. Dr. Kien has experience in working in many hospitals and universities. He also has experience in some healthcare system in Europe, Asia and Oceania. Besides the work as a doctor and lecturer, he is now pursuing PhD in Family Medicine Department of Antwerp University in Belgium. Good morning, Dr. Kien.
Yeah, good morning, Akulina. I'm very happy to meet you here.
Yes, I'm very happy too.
Yeah.
How are you today?
Yeah, I'm very happy to meet you, to give all my thinking to you and to all the audience of YouTube channel. Yeah, your YouTube channel.
Thank you. And I'm very excited too today. Getting the doctor's degree is long and hard way.
Yeah.
Why did you choose to become a doctor?
Yeah. Why do I choose to become a doctor? It's, I think, a very long story. Yeah. The first is my parents also work in medicine environment. So I exposed to medicine environment from very early. Yeah, and also my parents put me on the medicine environment by chance. So I have many time to live in medicine environment. So medicine absorbs into me gradually. And so that's easy for me after completing high school. The only thing I think to choose university is medicine. Yeah. So even now, if I have to choose again, I will choose medicine definitely. Yeah. So I think medicine is my passion.
Yes.
I think medicine is my destiny. Yeah.
Yeah, I mean, very handful number of people get this opportunity.
Yeah.
Some people I see the passion and profession is different.
Yeah.
But for you, I see your passion and profession is same.
Yeah.
And that's very important. You are lucky.
Yeah.
And I feel happy that you dreamt of becoming a doctor from your childhood.
Yeah.
Yes. A doctor is not born, a doctor is made. What do you enjoy most about being a doctor? How do you build trust with your patients?
Yeah. I can explain to you the first. You know that health is the most valuable thing for anyone. So if you want, if you are a doctor, you want the patient give you the church from them. I think at least have three conditions. The first is you have to be good at your career like a doctor. Yeah. The second, you have enough skill to persuade your patient to follow you. Yeah, even my advice or the doctor advice is good for the patient, but you have to have the skill to persuade them. And the second, I think, also very important is the honest. In fact, I am honest with my patient all the time I can.
Yes.
Yeah. Even when I do the mistake, I can honest to the patient. Yeah. So we have to understood from each other, and we have mutual sympathy, and then we have a good relationship. You know that the good relationship is not exist from beginning. It comes from the past and increasingly time. Yeah. So now when I become a senior doctor, I think that the trust from patient is the most important thing. Yeah.
Yes, we cannot build the trust
Yeah.
with you so easily.
Yeah.
You have to be very honest to your work,
Yeah.
to your patient, whatever you are doing, and giving value to the others.
Yeah.
Definitely they will come to you.
Yeah.
Even to your patients, maybe I'm making my YouTube channel, maybe
Yeah.
podcast, so I have to give the value to
Yeah.
the audience. Otherwise, it's nothing. And next, what are the advantages of working in both government and private sector? More patients. Okay.
Yeah, I have experience in many hospitals, yeah, and also I have experience in medical education, and I think most of the doctors in the world have to spend time on the government hospital from earlier. It means that right from graduating from medicine university, they spend time on government hospital. Why? It's because when they was not much experience, they have to learn many experience from a senior doctor, and in hospital environment they can learn from that. Yeah, no doctor can be good at the beginning. The doctor have much experience, so when they work in hospital, the mistake can be protected earlier with the senior doctors supervise. Yeah, and in hospital, they can see many severe case, many complicated case, so they gradually have enough experience. And when the doctor have enough experience, they can be mature in their career, and they can do alone. They can go to the private sector. Yes, so I think mostly of the doctor in the world will spend like that. I observe in the world, I see that.
Yes.
Yeah.
For the teachers also same.
Yeah.
We feel that if the teachers at the beginning,
Yeah.
they don't really become a good
Yeah.
teacher, but later when experience more students,
Yeah.
teach more students,
Yeah.
they can learn from the students.
Yeah.
And every mistakes we can learn
Yeah.
something. Same like the doctors. The
Yeah.
more you will treat patients,
Yeah.
more severe cases you are
Yeah.
confronting, you will
Yeah.
get more knowledge
Yeah.
and skilled doctor.
Yeah.
The ministry has approved a comprehensive plan to pilot strengthening the grassroots healthcare. How is the healthcare system is changing in Vietnam or Hanoi recently?
Yeah. I'm very happy to share with you about this topic. You know that Vietnamese economy is boosting very fast. With the standard of living of people in Vietnam is increasing, and more than that, so the healthcare requirement from the Vietnamese people in criticism. So the government put many efforts to develop the primary healthcare. So you can see the primary healthcare in government primary healthcare and private primary healthcare sector is in the way to be better, more and more better now. Yeah, so I think the Vietnamese people will get benefit from the government action. Yeah, so I think my government, like also my Ministry of Health, also Family Medicine Department in Hanoi Medicine University, is three of them in the way to move forward very fast to get up economy boosted in Vietnam.
We all can see that Vietnam is adapting the new demands. We all know that doctors are usually pretty much occupied in their schedule. What is your daily routine? I'm curious to know. How do you meet your mindset to finish your daily tasks during a challenging day?
As you know, doctor is very busy in manage the patient. But we have 3 or 4 work. You can share with me. I'm a lecturer at the hospital. And I'm doctor at the government hospital. And also I have a doctor at private polyclinic. And also I have 3 children. So I have to be in charge. So the typical day for me, the first I have to take my children go to school, and then depend on each day. I can meet some student, my student, and sometimes I work in hospital, and sometimes I work in the private clinic. And then I always return, come back home at 6 or 7 p.m. And the remaining time in the day, I play with my children, and also I lie sleeping. So that's my typical day.
Typical day, yes. I know you go through the hectic schedule. Still, you are managing the hospitals as a job of a lecturer, and at the same time running your own clinic and giving time to your children. So you are a better person. I can see that you are a perfect. You know how to manage your perfect time. Good at time management. Yes. Recently, you have visited Australia in the Family Doctor Exchange Program. What is your experience? And what is the advantage of family medicine?
And you know that the family medicine, the healthcare system depend on family medicine is the standard of family medicine in all over the world. And you can see now the Vietnamese is changing to that. But in Australia, I see they have stable systems. They have a long history of high quality healthcare systems, healthcare service. And in Australia, I can learn many things from family medicine education in Adelaide University. And also I can see the way Australia run a family medicine clinic. And I have to visit 5 clinics. I understood from the beginning of the education GP, and then how the family medicine clinic run in model. It's valuable for me.
Yes, basically we don't know much about this field, but still I heard from the people and from you that there is a different kind of system in developed country and developing country. In developed country, they have the GP. First, you have to consult the GP, that means general practitioner, right? If he thinks that we need the specialized doctor, then he can refer to the specialized one.
Yeah.
And then they can refer them to the super specialized. But in developing country, it's very funny though. What we do, we think we have the headache.
Yeah.
We straight away go to the doctor of the brain,
Yeah.
like something like that. But maybe that headache is not coming from my brain.
Yeah.
It's coming from different area.
Yeah.
But who will understand that? We are not the doctor. We are
Yeah.
not the GP. We are not the family medicine.
Yeah.
We don't have any knowledge about
Yeah.
that. But in developing country, we don't have that kind of system.
Yeah.
That is a problem. But yes, it's very great news from you. I hear
Yeah.
that Vietnam is trying to change the model,
Yeah.
like the family medicine model, GP model
Yeah.
in Vietnam.
Yeah.
Soon, I think the other countries also, if they try to do that, and they can.
Yeah.
I think they can.
Yeah.
Sometimes, if you are really keen, you can.
Yeah.
I feel.
I can share with you a GP still exists in Vietnamese healthcare system for so long, but their capacity still not good. So now the government and the Ministry of Health see that, and they can focus on increasing the GP capacity and knowledge. The fundamental of the system, healthcare system, is primary healthcare.
Primary healthcare,
Yeah.
yes. How is the what is the model of your private clinic now?
Yeah.
And what can you please explain to us? Like, I know you are running a clinic.
Yeah.
Yes.
As you know, in the developed country, every people with the health problem have to go to the first gate. It is the GP or family medicine. Yeah, so I'm teach in family medicine department of Hanoi Medicine University. That's why I run my private clinic first on family medicine principle. Yeah, it means that you can have any problem, you can come the first, and then the GP here, if they can do, they can let you in the clinic to manage. And if over their capacity, the doctor capacity, they will refer you to the higher level. But one thing I want to mention is that my clinic is very near, only 1 to 2 minutes from many national hospitals, so I can discuss with them easily. Yeah, so in fact, my private clinic is we not two car, first a GP, family medicine, and then a specialist. Yeah, because I have a chance, I have so much chance to do that, because I based on many good specialists.
That means in your clinic we can get the GP, you, and your clinic is surrounded by major hospitals, so you can connect the specialist within a short decision or quickly. You can connect them and you can get them at your clinic and consult with them for the patients. What is your suggestions for the foreigner like me to come to the clinic in Hanoi?
For foreigner, if they meet health problem, they should go to the hospital or clinic which provide English service, because language is the first barrier. So you should go the hospital like Hanoi Medicine University Hospital or some big hospital, a government hospital like Bạch Mai or and Saint Paul Hospital in Hanoi. And also you can go to the private hospital which provide the healthcare service for foreigners. The first thing you have to check is the hospital can give the service for foreigners. Because if they provide it, so there's a doctor there can speak English. So you can do later with
yes.
HH.
Any specific tips for our friends to follow on a regular basis to stay healthy and happy?
Yeah, I think this question is the same to everyone in every country. Is I mean that's what you can get to have good health. Yeah, you can. I think that any people have to three parts. First is physical health, and the second is mental health, and the third is environment health. Yeah, so if you want to have a good health, you have to do three things. Yeah, first you have a physical health. You have to do exercise regularly. You have to eating healthy foods. And the second in mental health, you avoid the harmful thing. It can fire your brain.
Yes.
Yeah, and the second, the last is the environment. You have to protect you from harmful environment. You avoid from that. Yeah, and even a foreigner come to Vietnam, I think you follow all the common advice for any people in the world.
Yes.
Yeah.
Everyone from the world, any doctor from the world, they will suggest the same like you. You take care of physical health, physical activity.
Yeah.
Careful about your diet.
Yeah.
And the third is the mental health. Many of us, we really don't care about our mental health, but it is the time to take care of our mental health and stay away from the environment what is harmful for you.
Yeah.
Thank you for your sharing your knowledge, Mr. Kien. It's huge. I think 20 minutes is not enough.
Yeah.
Later on, I will discuss about the diabetic depression in 1 hour podcast in my channel.
Yeah.
Looking forward to see you again in my podcast in the future for many discussions. Today, I would like to conclude my discussion with Dr. Kien. Next week, I will come up with a new video with a new person.
Thank you very much.
Thank you.
Bye-bye. Yeah.
Thanks for your time.